Hi everyone, welcome to another webisode of The Good Doctor on eZeLiving.com. Today I'm in the company of Dr. Rajesh Shah from the Allied Diagnostic Center in Dubai. Welcome to the program.
Thank you very much.
So today's topic of conversation is about sports injuries. My first question is, what kind of sports injuries are out there?
Let me keep it very simple. Now, the basic types of sports injuries are the acute ones and the not so acute ones. And we can divide these injuries also in another way as to professional sports injuries and other sports injuries which a common man faces while playing sport as a hobby. So what's the basic difference between them? The basic difference is that in a professional sports injury, they are trained athletes who are undergoing these routines which they are accustomed to. Whereas in a non-trained athlete, a common man, it is unaccustomed stress. All of a sudden he decides to play soccer today, or he does something out of his normal, and then they suffer an injury because he's not trained to that.
So in either case, what are some of the cures, what are some of the procedures that one needs to take once they experience an injury?
So basically, when we talk about imaging, what is the role of imaging in any sort of sport injury? Imaging comes in where it's going to make any impact on the management of the patient. You just don't start imaging a patient without any direction. Basically, you have to have a clinical examination for the patient, see what the clinical findings are, how severe the injury is, whether it is associated with any major neurological deficit or a major neurological trauma, say for example a head trauma or a trauma to the spine. So in those cases we need to prioritize what we are first concentrating on, because a fracture is less important than a head injury. So we need to prioritize it in those ways and then go on for the imaging. And the other thing is that the patient is undergoing treatment, okay? He's having physiotherapy, he's having conservative treatment, but he's not improving. This is when imaging again steps in, because you need to know why he's not responding. Are we missing something vital over there which needs to be corrected? So this is where imaging again comes in. And the last part is pre-operative. When they actually decide to intervene, they need to have a pre-operative documentation that this is the injury and this is what we're going to do.
The question now is, what kind of imaging procedures or equipment is out there to see inside the body for various traumas and injuries that you just talked about?
Yeah, that's very interesting, because we have a lot of things that we can do, right from simple x-rays to ultrasound to CT scan or MRI and even nuclear imaging. So one is the x-ray, because why? It is easily available in most of the places and it can tell you a lot of things, basically the bone. If the x-ray is clear, nothing but the patient has pain, has trauma, swelling and things like that, we go to the next thing, which is ultrasound. Ultrasound is something which does not involve any sort of radiation and it is a dynamic study. So what happens is that we can actually put the probe on the part, we see what's going on over there and make a differential diagnosis on that. The other thing is CT scan for hairline fractures, which we may not even see on x-rays. So this is where a CT comes, it has got the 3D reconstructions and things like that. And finally, the gold standard, which is now followed for most athletes, professionals and things, is the MRI. MRI has an excellent soft tissue contrast in itself and it involves no radiation. So MR helps in knowing all the details of the soft tissue, because it's not just a bone injury. It often is with a ligament tear or a muscle tear and things like that. So the bone may heal, but these things take time to heal. And the patient keeps telling that, no, I still have pain, I have this, probably a disability and things like that. So this is where imaging comes in, and we need to know precisely what's going on, why the patient is not 100% responding to the treatment. So this is where MRI has a major role in it. Sometimes the patient keeps on complaining of pain, the x-ray is 100% clear. He's a jogger who runs for a long distance and so on. This is where we find stress fractures. This is only picked up on MRI. So this is where intervention has to come in with imaging, because we need to know what's going on. We can prevent the long-term damage and therefore it helps in healing the patient much earlier.
There are different tools out there and machines and devices that can detect various depth levels.
Exactly.
And the MRI obviously is the ultimate machine that can right now scan at the deepest level.
Most of the deep levels, and also tells you the soft tissues and the bony portions of it. So it is more or less a complete examination, but I'm not saying that is the only examination. It has to be complemented by other things which we feel at that particular time is the best for the patient. So very often the clinician will call us, we will discuss what is the best thing to do for the patient and protocol it almost tailor-make it for the patient so that he has the best outcome from it.
Well, thank you very much for this insightful information. I certainly learned a lot. If you've got any thoughts, comments, or questions about this webisode, please leave them in the comments section down below, and the Good Doctor will definitely respond. Thanks for watching The Good Doctor on eZeLiving.com, where you can find anything and everything lifestyle.